Hi, my name is Dr. Rajat Nan Ahmed and I'm a psychiatrist working in UK. And this video is part of my NHS job interview question series where I'm trying to tackle some of the commonly asked questions which you may encounter in the NHS job interview. This is particularly for the help of IMGs who may not have seen these questions before. Remember, I'm not trying to give you any model answers. I'm just talking about the basic concepts behind these questions and you will have to come up with your own answers. So let us tackle another commonly asked question. You may be asked about breaking bad news. This may be asked directly to you that how do you break bad news? They might give you a clinical setting and say that this is a bad news and how will you approach this to break. Or they may ask you an example of tell us recently if you have broken a bad news, how did you approach that? So regarding breaking bad news, this is a very common and basic question, which the medical students in UK are taught, and this is part of their postgrad exams as well for doctors. And if you've done PLAB, you must have seen this in your PLAB exams as well. So you can read through that those things again, and then you will be able to tackle it more effectively. But when I am teaching Breaking Bad News, I normally teach the Spikes model, and Spikes model was developed by oncologists back in 2000, specifically for the Breaking Bad News about cancer to the cancer patients in oncology. But it is used in other settings as well. Spikes just give you a framework and prompts, that things you will find useful for breaking bad news. You don't have to follow the complete structure of Spike. So Spikes talk about, setting up, having understanding of the perception of the patient, invitation for the patient to express themselves, knowledge which you should have and be able to transfer to the patient, showing empathy, and then summarizing. So this makes the Spikes the acronym. In simply explaining, setup is very important when you're breaking bad news. Setup means that the physical setup of where will you break the bad news, but you to have the understanding of the patient as well, knowledge of the background, the history. If you're going to break bad news, you need to understand what investigation or what management has been done, and what level of information is available to you, and what are you going to tell the patient, and what kind of follow-up question may be asked, what are the follow-up arrangements or the further management that you might be able to tell the patient or might not be able to tell the patient, or send them to another specialist. If you think you're not ready to break that bad news, or you don't have enough knowledge, you can ask for help from your senior. If they're not physically present, they can always speak to you on the phone, but you can also get help from your nursing colleagues as well, like support when you're actually going to break bad news. And also, as part of setup, you can also sometimes ask the patient to bring somebody who they find supportive as well with them. In Spike's model, they talk about perception, understanding the patient's understanding of the condition, and investigation or the things that have gone so far. Obviously, patients have gone through some kind of medical input, and their understanding of what's going on is very important, because then you can build on from then onwards. Then inviting is that sort of inviting the patient to express themselves freely, to understand how much, what are the emotion at this stage, and what else they like to know, or what level of information you are going to give them. But it's very important that when you're breaking bad news, that you have the correct knowledge, the factual knowledge, and when you are breaking bad news, you cannot hold back information. If you have given the patient an impression that there is a bad news, the patient will already be very anxious. So you need to be very straightforward and tell them exactly what you've found and what is the bad news. So you cannot hold back information at that point. This is an important part of breaking bad news. But it's also important to acknowledge when you have given the patient very bad news, they may not be able to absorb the whole information, and you may have to wait. You may have to actually give them some time, give them some comfort, show them some empathy, give them some support, and you might have to give the further information in chunks, and to check that if the patient is actually absorbing that information, understanding that information, or they need more support in that. Sometimes we require the information to be given in the written format as well, so patient can take it away with them. Sometimes patient has a lot of questions, you may not have answers, but you can ask, you can note down their question and come back to them with those answers. But at least you should have the basic level of knowledge when you're breaking bad news, and you need to have support from your seniors as well if that is required at a junior level. Communication is very important in breaking bad news. Communication includes you communicating clearly. It also include your listening skill, your empathy skill. It also include your ability to actually take this consultation and at patient's pace rather than you trying to impose whatever you got in knowledge onto the patient. But actually, every individual patient and every situation breaking bad news is very sensitive, and it will be very unique, so you might not be able to assume what will happen in the situation, but you have to improvise when you're in the situation to make sure that you're actually doing the best for the patient and giving them the right information and giving them the right support. And breaking bad news doesn't stop there. The patient might need support, further information, further follow-ups in the future. So that is something that you need to also counter in the fact. So just to summarize, if you ask the question about how do you break bad news, you have to explain some of the things I have mentioned in my explanation. The setup, gathering information about the patient, speaking to your senior, making sure that you have the right factual information, then taking that consultation at the patient's pace. Make sure that you are very clearly communicating the bad news, and then you have the right support available for the patient at the point. Right support available for you as well. You might need steps while you're explaining your answer will help to formulate a good answer. I think that will be satisfactory for the panel who are listening to you. So thank you very much for listening to me, and in the next video we will try and tackle another commonly asked question. Thank you.